te kauae raro is conceptualised as the kind of Mātauranga Māori practices that enable us to practice our own cultural ways of being here on Papatuanuku. So it is things like the practice of raranga, the practice of kokowai, whale flensing, hauhake tohora, and we're really interested in how those things are taught in hauora wānanga held in Hihiaua in Whangārei Te Rerenga Paraoa, but also how those practices and the learning of those practices can elevate a person's sense of themselves, their identity, their connection to Te Tai Ao more broadly, and beyond, of course, into kauae runga. So we're looking at how the learning of practical cultural ways of being enhance a person's sense of identity, their sense of connectedness to community, and the ways those practices actually help to hohou te rongo, help to heal people, help to heal their whānau, their community. And in this project we plan to investigate how those learning progressions happen, what instigates them, what sustains that learning beyond the wānanga itself, and two, the impacts of what is learnt, the Mtauranga tuku iho, on the ways they choose to live beyond the wānanga, in their whānau, in their community, and perhaps importantly the passing on of that mātauranga to other members of their family. There's a need for this research because much of the work done in both the health and education system are predicated on Western knowledge, Western ways of doing, Western ways of healing. And what we know through our engagement with Hihiaua Cultural Centre and many of the mātanga from Te Tai Tokerau is that we actually hold many of the solutions in our hands, kei a tātou ringa, to help our whānau, our hapore, hapu, iwi, heal themselves. So this project is not only focused on what happens in the wānanga, but also utilising some of our Tai Tokerau learning frameworks, things that emerge from our whare wānanga, that teach us how people learn. I'm not sure I navigate te kauae runga and te kauae raro purposefully, intentionally in my everyday life, but one of the things we're learning about in our engagement with mātanga from Te Tai Tokerau is that the practical things we learn here in te kauae raro that help us to function in everyday life, that help us to work alongside others in our own cultural ways, tikanga informed kind of cultural practices, actually do other kinds of work, unbeknownst to us most of the time, in the te kauae runga realm. It's really significant to receive an HRC grant as a member of a cable faculty. So education and social work don't usually receive HRC grants, but I think, and I'm deeply grateful, that the HRC granting panel recognised the ways educational knowledge and what happens in the education realm can be of use in health education spaces as well, because that's what this project is doing. It's taking what we know about pedagogy and about what works for young people, rangatahi, taitamariki, and we're thinking about how can those learnings apply to the teaching of school nurses and counsellors and medical professionals. How can the distinctive ways that Māori learn about hauora be useful for non-Māori and or other upcoming Māori health and education professionals?